Namaste viewers, welcome to Sri Ananta YouTube channel. In our last episode, Swamiji was explaining ear problems. In today's episode, let us ask Swamiji to explain about acoustic neuroma.
Acoustic neuroma is a non-cancerous tumor that develops on the main nerve leading from your inner ear to your brain. The exact cause of acoustic neuroma is not fully understood, but there are several factors that can contribute to its development. Genetic factors. Some cases of acoustic neuroma are associated with genetic condition called neurofibromatosis. This is type 2, NF2 we call. People with NF2 have a higher risk of developing acoustic neuroma. Second, exposure to radiation. Previous exposure to high doses of radiation such as radiation therapy for head and neck tumors can increase the risk of developing acoustic neuroma. Third is age-related factors. Acoustic neuroma are more commonly diagnosed in adults aged 30 to 60, although they can occur at any age. Then based on gender, studies have shown that women are more likely to develop acoustic neuroma compared to men. Occupational exposure. Some studies suggest that long-term exposure to certain chemicals such as vinyl chloride or formaldehyde may increase the risk of developing acoustic neuroma. It is important to note that in most cases the cause of acoustic neuroma remains unknown. If you suspect you may have an acoustic neuroma or experiencing symptoms related to it, it is essential to consult a doctor. So today I am going to share with you in what way our hospital treats the ear disease, and in that specially the vermology which we have taken as the main treatment protocol. In that I am going to speak about certain arteries where if we do some manipulation and stimulation, definitely that will help. So the arteries of the ear are branches of external carotid artery, which is a major blood vessel that supplies blood to the head and neck region. The specific arteries that supply the ear include posterior auricular artery. This artery originates from the external carotid artery and supplies blood to the posterior part of the ear as well as the skull behind the ear. Anterior tympanic artery. This artery arises from the anterior auricular artery, which is a branch of superficial temporal artery. It supplies blood to the anterior part of the ear, including tympanic membrane. Superficial temporal artery. This artery is also a branch of external carotid artery. While it is primarily supplies blood to the scalp, it may also send branches to the lateral aspect of the ear. Deep auricular artery. This artery is a branch of maxillary artery, which is another branch of external carotid artery. It supplies blood to deeper structure of the ear, including the cartilage and external auditory canal. Overall, these arteries work together to ensure a sufficient blood supply to various parts of the ear, including the external ear, the middle ear, and the surrounding structures. So in this way we do certain manipulation and stimulation based on these arteries in order to manage, prevent or cure the ear disorders. Hence we will come up with next part of the allied ailments of the central nervous system in our next episode. Till then, stay blessed. Om Sai Ram.